51. A nurse is providing education to a patient taking isoniazid for tuberculosis. Which instruction is most important? 1. Avoid caffeine. 2. Take with vitamin B6. 3. Avoid dairy products. Answer: take with vitamin B6. Explanation: isoniazid can cause peripheral neuropathy, which can be prevented by taking vitamin B6, pyridoxine. 52. A nurse is caring for a patient receiving vancomycin 4. Which assessment is most important to prevent complications? 1. Assess for ototoxicity. 2. Check glucose levels. 3. Monitor pupil response. Answer: assess for ototoxicity. Explanation: vancomycin can cause ototoxicity and nephrotoxicity. Monitoring for signs like tinnitus or hearing loss is essential. 53. A patient is prescribed methyldopa for hypertension during pregnancy. Which adverse effect should the nurse monitor for? 1. Proteinuria. 2. Liver dysfunction. 3. Increased fetal heart rate. Answer: liver dysfunction. Explanation: methyldopa can cause hepatotoxicity. Monitoring liver enzymes and signs of hepatic damage is important. 54. A nurse is administering heparin subcutaneously. Which action is correct? 1. Massage the site after injection. 2. Aspirate before injection. 3. Inject into the abdomen and avoid rubbing. Answer: inject into the abdomen and avoid rubbing. Explanation: heparin should be injected subcutaneously in the abdomen without rubbing to prevent hematoma formation. 55. A nurse is reviewing a prescription for linezolid. Which medication should the nurse question if also prescribed? 1. Acetaminophen. 2. Sertraline. 3. Metformin. Answer: sertraline. Explanation: linezolid is a weak MALI and should not be used with SSRIs like sertraline due to the risk of serotonin syndrome. 56. A nurse is caring for a patient with asthma who is prescribed Monteliacast. Which statement by the patient indicates a need for further education? 1. I will take this every day in the evening. 2. I will use it during an asthma attack. 3. This helps prevent my symptoms. Answer: I will use it during an asthma attack. Explanation: Monteliacast is a maintenance medication and is not effective for acute asthma attacks. 57. A patient taking prednisone for chronic inflammation reports black, tarry stools. What is the nurse's priority action? 1. Encourage fluids. 2. Notify the provider immediately. 3. Reassure the patient. Answer: notify the provider immediately. Explanation: black, tarry stools may indicate gastrointestinal bleeding, a known side effect of corticosteroids like prednisone. 58. A nurse is caring for a patient on gentamicin therapy. Which lab result indicates a need for intervention? 1. BUN 28 mg per deciliter. 2. Hemoglobin 12G/DL. 3. Potassium 4.1 milliequivalent/L. Answer: BUN 28 mg per deciliter. Explanation: elevated BUN may indicate nephrotoxicity, a known adverse effect of aminoglycosides like gentamicin. 59. A nurse is preparing to give a beta blocker. Which finding would cause the nurse to hold the dose and notify the provider? 1. BP 110/70 mmHg. 2. HR 50 BPM. 3. O2 saturation 95%. Answer: HR 50 BPM. Explanation: beta blockers decrease heart rate. A heart rate of 50 BPM is bradycardic and may require withholding the dose. 60. A nurse is providing discharge teaching to a patient prescribed levothyroxine. Which statement indicates understanding? 1. I will take this with breakfast. 2. I will take it at night to help sleep. 3. I will take it in the morning on an empty stomach. Answer: I will take it in the morning on an empty stomach. Explanation: levothyroxine is best absorbed on an empty stomach, typically 30 to 60 minutes before breakfast in the morning. 61. A nurse is reviewing the medication list of a patient on clopidogrel. Which medication would the nurse question? 1. Aspirin. 2. Metoprolol. 3. Atorvastatin. Answer: aspirin. Explanation: both clopidogrel and aspirin have antiplatelet effects, increasing the risk of bleeding when used together. 62. A patient with chronic kidney disease is prescribed aluminum hydroxide. What is the purpose of this medication? 1. To neutralize gastric acid. 2. To bind phosphate in the GI tract. 3. To treat constipation. Answer: to bind phosphate in the GI tract. Explanation: aluminum hydroxide is used as a phosphate binder in CKD to reduce serum phosphate levels. 63. A nurse administers naloxone to a patient with respiratory depression. What is the most important follow-up action? 1. Reassess pain level. 2. Monitor for recurrent respiratory depression. 3. Monitor urine output. Answer: monitor for recurrent respiratory depression. Explanation: naloxone has a shorter half-life than opioids, so respiratory depression can recur once it wears off. 64. A patient with Parkinson's disease is prescribed levodopa-carbidopa. Which dietary instruction is most appropriate? 1. Increase protein intake. 2. Take with high-fat foods. 3. Avoid high-protein meals. Answer: avoid high-protein meals. Explanation: high-protein meals can interfere with the absorption of levodopa, reducing its effectiveness. 65. A nurse is educating a patient about alendronate for osteoporosis. Which instruction is correct? 1. Take with a full glass of milk. 2. Lie down for 30 minutes after taking. 3. Sit upright for at least 30 minutes. Answer: sit upright for at least 30 minutes. Explanation: alendronate can cause esophageal irritation. Sitting upright prevents reflux and esophagitis. 66. A nurse is reviewing a new prescription for fluoxetine. What is the priority patient teaching? 1. May cause weight loss. 2. Takes several weeks to take effect. 3. Can be stopped abruptly. Answer: takes several weeks to take effect. Explanation: fluoxetine and SSRI typically takes 4 to 6 weeks to reach therapeutic effect. This should be explained to promote adherence. 67. A patient taking furosemide reports muscle cramps. What is the nurse's best response? 1. Encourage activity. 2. Check potassium levels. 3. Suggest increasing sodium intake. Answer: check potassium levels. Explanation: furosemide is a loop diuretic that causes potassium loss. Muscle cramps may indicate hypokalemia. 68. A patient is prescribed rifampin for tuberculosis. Which teaching is most important? 1. May cause drowsiness. 2. May turn body fluids orange. 3. Take with food to avoid GI upset. Answer: may turn body fluids orange. Explanation: rifampin commonly turns urine, sweat, and tears orange red, which is harmless but may alarm patients. 69. A nurse is caring for a patient prescribed amiodarone. Which adverse effect requires immediate attention? 1. Dry cough. 2. Nausea. 3. Constipation. Answer: dry cough. Explanation: a dry cough may indicate pulmonary toxicity, a serious adverse effect of amiodarone, and requires prompt evaluation. 70. A patient with diabetes is prescribed prednisone. What is the nurse's priority action? 1. Monitor blood glucose levels. 2. Assess weight weekly. 3. Encourage low-sodium diet. Answer: monitor blood glucose levels. Explanation: corticosteroids like prednisone can elevate blood glucose, especially in diabetic patients. 71. A nurse is caring for a patient prescribed enoxaparin. What teaching is most appropriate? 1. Massage the site after injection. 2. Avoid taking aspirin. 3. Take this medication with food. Answer: avoid taking aspirin. Explanation: aspirin increases bleeding risk when taken with anticoagulants like enoxaparin. 72. A patient taking methotrexate for rheumatoid arthritis develops a sore throat. What should the nurse do first? 1. Reassure the patient. 2. Document the finding. 3. Notify the provider. Answer: Notify the provider. Explanation. A sore throat may indicate infection due to bone marrow suppression. It must be reported promptly. 73. A nurse is preparing to administer atropine preoperatively. What effect should the nurse expect? 1. Increased salivation. 2. Decreased heart rate. 3. Decreased oral secretions. Answer. Decreased oral secretions. Explanation. Atropine is an anticholinergic used to reduce oral and respiratory secretions before surgery. 74. A nurse is caring for a patient taking valproic acid. Which lab value requires immediate follow-up? 1. Platelet count of 70, 0.000/mm, superscript 3. 2. Sodium of 135 milliequivalent/L, 3. Hemoglobin of 13G/DL. Answer. Platelet count of 70, 0.000/mm, superscript 3. Explanation. Valproic acid can cause thrombocytopenia. A low platelet count increases bleeding risk and requires attention. 75. A nurse is educating a patient on nitrofurantoin for urinary tract infection. What is the most important teaching point? 1. May discolor urine brown. 2. Take with antacids. 3. Discontinue once symptoms subside. Answer. May discolor urine brown. Explanation. Nitrofurantoin can turn urine brown. This is harmless and should be explained to reduce concern. 76. A patient prescribed captopril reports a persistent dry cough. What should the nurse do? 1. Suggest lozenges. 2. Hold the next dose. 3. Notify the provider. Answer. Notify the provider. Explanation. A dry cough is a common side effect of ACE inhibitors like captopril and may require changing the medication. 77. A nurse is administering a new dose of hydralazine. Which assessment is most important? 1. Respiratory rate. 2. Blood pressure. 3. Level of consciousness. Answer. Blood pressure. Explanation. Hydralazine is a vasodilator used to lower blood pressure. Monitoring BP is essential to avoid hypotension. 78. A patient is started on azithromycin. Which adverse effect should the nurse report to the provider? 1. Mild nausea. 2. Watery diarrhea. 3. Headache. Answer. Watery diarrhea. Explanation. Watery diarrhea may indicate Clostridioides difficile infection, a serious complication of antibiotic therapy. 79. A nurse is caring for a patient receiving 4-metoclopramide. What side effect requires immediate intervention? 1. Restlessness. 2. Tardive dyskinesia. 3. Dry mouth. Answer. Tardive dyskinesia. Explanation. Tardive dyskinesia is a serious extrapyramidal symptom characterized by involuntary movements and may be irreversible. 80. A nurse is educating a patient on how to use a nitroglycerin patch. What statement by the patient indicates correct understanding? 1. I will remove the patch at bedtime. 2. I will rotate patch sites weekly. 3. I will apply a patch over my heart daily. Answer. I will remove the patch at bedtime. Explanation. Removing the nitroglycerin patch at night prevents nitrate tolerance, maintaining its effectiveness. 81. A patient receiving gentamicin 4 develops tinnitus. What is the nurse's priority action? 1. Reassess in 30 minutes. 2. Continue the infusion. 3. Notify the provider immediately. Answer. Notify the provider immediately. Explanation. Tinnitus may indicate ototoxicity, a serious adverse effect of gentamicin. Prompt action is needed to prevent permanent hearing loss. 82. A patient is taking lithium for bipolar disorder. Which lab value should the nurse monitor regularly? 1. Blood glucose. 2. Serum sodium. 3. White blood cell count. Answer. Serum sodium. Explanation. Lithium excretion is affected by sodium levels. Low sodium can lead to lithium toxicity. 83. A nurse administers warfarin. Which patient statement indicates a need for further teaching? 1. I will use an electric razor. 2. I can eat as much spinach as I want. 3. I will have my INR checked regularly. Answer. I can eat as much spinach as I want. Explanation. Foods high in vitamin K, like spinach, can reduce the effectiveness of warfarin. Consistency in intake is important. 84. A nurse is providing teaching about phenytoin. Which instruction should the nurse include? 1. Brush and floss daily. 2. Avoid dairy products. 3. Take with antacids. Answer. Brush and floss daily. Explanation. Phenytoin can cause gingival hyperplasia. Good oral hygiene can help prevent this side effect. 85. A patient on digoxin has a serum potassium of 3.0 milliequivalent/L. What is the nurse's priority? 1. Hold digoxin and notify the provider. 2. Give potassium supplement. 3. Administer digoxin as prescribed. Answer. Hold digoxin and notify the provider. Explanation. Hypokalemia increases the risk of digoxin toxicity. The medication should be held and the provider notified. 86. A nurse is teaching a patient about simvastatin. Which instruction is most important? 1. Take with grapefruit juice. 2. Take in the morning. 3. Report muscle pain immediately. Answer. Report muscle pain immediately. Explanation. Muscle pain may indicate rhabdomyolysis, a rare but serious adverse effect of statins. 87. A nurse is caring for a patient prescribed isoniazid. What lab value should be monitored closely? 1. AST and ALT. 2. Creatinine. 3. Hematocrit. Answer. AST and ALT. Explanation. Isoniazid is hepatotoxic. Liver enzymes must be monitored to detect liver injury early. 88. A patient receiving morphine 4 becomes drowsy with a respiratory rate of 8 per minute. What is the nurse's first action? 1. Apply oxygen. 2. Administer naloxone. 3. Stop the 4 fluids. Answer. Administer naloxone. Explanation. Naloxone is the opioid antagonist used to reverse life-threatening respiratory depression caused by morphine. 89. A nurse is preparing to give vancomycin 4. Which action is most important to prevent complications? 1. Administer over 30 minutes. 2. Dilute in dextrose. 3. Infuse slowly over at least 60 minutes. Answer. Infuse slowly over at least 60 minutes. Explanation. Rapid infusion of vancomycin can cause red man syndrome, a histamine reaction. Slow infusion reduces this risk. 90. A patient is started on metformin. What is the most important teaching point? 1. Avoid alcohol. 2. Expect weight gain. 3. Stop if blood sugar is low. Answer. Avoid alcohol. Explanation. Alcohol increases the risk of lactic acidosis, a rare but serious side effect of metformin. 91. A nurse is caring for a patient with asthma prescribed theophylline. Which finding is most concerning? 1. Insomnia. 2. Nausea. 3. Palpitations. Answer. Palpitations. Explanation. Palpitations may indicate theophylline toxicity, especially if accompanied by other CNS or cardiac symptoms. 92. A patient prescribed methimazole for hyperthyroidism develops a fever and sore throat. What should the nurse do? 1. Advise rest and fluids. 2. Reassure the patient. 3. Notify the provider immediately. Answer. Notify the provider immediately. Explanation. These symptoms may indicate agranulocytosis, a serious adverse effect of methimazole. Immediate evaluation is needed. 93. A nurse is preparing to give a scheduled dose of diltiazem. The patient's BP is 8856 mm of mercury. What is the nurse's action? 1. Give the medication. 2. Hold the medication and notify the provider. 3. Raise the head of the bed. Answer. Hold the medication and notify the provider. Explanation. Diltiazem can lower blood pressure further. It should be held when hypotension is present. 94. A patient with type 2 diabetes is prescribed glipizide. What is the most important instruction? 1. Take at bedtime. 2. Skip dose if not eating. 3. Eat extra carbs with each meal. Answer: skip dose if not eating. Explanation: glipizide increases insulin secretion. Skipping meals increases the risk of hypoglycemia. 95. A nurse is caring for a patient taking allopurinol. What is the primary purpose of this medication? 1. Prevent acute gout attacks. 2. Lower serum uric acid levels. 3. Treat gout pain. Answer: lower serum uric acid levels. Explanation: allopurinol helps prevent future gout attacks by reducing uric acid, not by relieving acute pain. 96. A nurse is administering for potassium chloride. What is the priority action? 1. Administer undiluted for fast effect. 2. Infuse slowly using a pump. 3. Shake the bag to mix. Answer: infuse slowly using a pump. Explanation: for potassium must always be administered via pump at a controlled rate to prevent cardiac complications. 97. A nurse is caring for a patient on long-term prednisone therapy. Which finding is most concerning? 1. Mood swings. 2. Delayed wound healing. 3. Moon face. Answer: delayed wound healing. Explanation: long-term corticosteroids suppress immune response and delay healing, increasing infection risk. 98. A nurse is administering insulin glargine. What statement is correct about this insulin? 1. It should be mixed with regular insulin. 2. It is taken with meals. 3. It has no peak and lasts up to 24 hours. Answer: it has no peak and lasts up to 24 hours. Explanation: insulin glargine is a long-acting insulin with no peak, providing steady glucose control. 99. A nurse is preparing to administer ceftriaxone IM. The patient has a penicillin allergy. What is the priority action? 1. Administer as ordered. 2. Hold and notify the provider. 3. Give diphenhydramine first. Answer: hold and notify the provider. Explanation: cephalosporins like ceftriaxone have a cross-sensitivity with penicillin. The provider must be notified before administration. 100. A patient with schizophrenia is taking clozapine. What findings should the nurse report immediately? 1. Mild sedation. 2. Constipation. 3. Fever and sore throat. Answer: fever and sore throat. Explanation: clozapine can cause agranulocytosis. Fever and sore throat may indicate infection due to neutropenia.